together. And that actually is a perfect bridge. Let me thank all of our housing panelists and turn to our health panelists, because we all know housing and health are hand in hand. So thank you so much for your time, and be well on a very busy historic day. Let me welcome. Again, California is so blessed by such a incredible cadre of leadership that I want to welcome to as we talk about Goal 2, Health Reimagined. I think my team will flash that slide up so we can just remind ourselves of this is probably one of our most robust areas of the plan, covers so many fronts. And so we'll do our best to dive in today on Health Reimagined. And this is about having access to the health services, health coverage, health care we need to live at home and in our communities, and to optimize our health and our quality of life all across the lifespan. And our bold goal is to close the equity gap in and increase life expectancy for all Californians. Next slide, please. I'm delighted today to be joined by J.C. Cooper. We're so lucky in California to have such an incredible Medicaid director, and more than that, Chief Deputy Director of Healthcare Programs, J.C. Cooper from Department of Healthcare Services, Assembly Member, and Dr. Joaquin Arambula, Chair of Assembly Budget Subcommittee on Health and Human Services, and Maya Altman, who CEO of the Health Plan of San Mateo, and also a Master Plan for Aging Stakeholder Advisory Committee member. So with that, if we could bring all three of their windows up so we can see and hear them as well. And we are going to start with our state representative, J.C. Cooper, and just welcome all. We'll let Rafi's still with us, but we'll figure that out. We're always happy to have the more the merrier. But JC, I thank you so much for joining us. And we're going to do this. We're trying this lightning round format where we're going to go around to all of you 3 times. Really first starting with that 10-year bold view, moving to 2-year legislative session, both at the state and federal level. What can we get done? And then I'm going to, close with that 100-day commitment. So to start, JC, how about the big vision? Reactions, thoughts on that in a couple minutes?
Sure. So I think it won't surprise anyone to say that we're really excited, not only for the Master Plan on Aging, but to use CalAIM to help us leverage some success in alignment with the Master Plan on Aging. One of the main goals there is also a 10-year roadmap and goal for Medi-Cal in regards to how do we work to implement a whole system, person-centered approach to equitable both health and social care. And really that highlights the services that I think will be most beneficial for our older adults in our programs. Rolling out things like enhanced care management for people at risk of institutionalization, and in lieu of services like respite and housing wrap services when in RCFEs and ARFs. So really excited about some of the not only housing opportunities, but as well as the additional wrap services for individuals in Medi-Cal moving forward. We also are hoping that it will help us build a roadmap to manage long-term services and supports by 2027. That is a goal of California's, to have a comprehensive home and community-based service roadmap to be able to have really comprehensive managed long-term services and supports in our Medi-Cal program. We're also working in the 10-year span, even sooner than that, to transition from our CCI program to a statewide DSNP proposal for our dual beneficiaries. Excited about that. We're also working to build, with some of the Money Follows the Person grant dollars, a Medi-Cal roadmap for home and community-based services. Where are gaps across California? Where are the disparities that exist within that system, so that we can build a multi-year strategy to really start ensuring that our beneficiaries have access to really critical services, and most notably and important for our older adults in Medi-Cal. And then last but not least, we're really excited to, as proposed in the budget, hopefully launch the Office of Medicare and Innovation and Integration. We really think that will help, leverage a really good relationship that we have with CMS. How do we expand some of those similar opportunities that we're seeing implemented in Medi-Cal, but also with our Medicare beneficiaries? How do we get a footprint on in lieu of services or other HCBS services in Medicare, and really partner with them to figure out how we can work together on mutual benefits and options that will be better for all Californians. And then last, but definitely not least, really important is how we look at expanding opportunities for family caregivers. I can say for myself, having recently lost my mother this summer to Alzheimer's, it is so important that we invest in all of those caregiver supports and really move the needle in that space. So I look forward to working with you, and hopefully I met the rapid fire 10-year roadmap that you're looking for there, Kim.
I think you just set a record for laying out a vision for whole person health and social care across multiple payers and systems in 2 minutes with great smarts and heart. So thank you so much, JC. Dr. Arambulis, she gave you a hard act to follow, but I know you can do it. I can't wait to hear your vision, Assemblymember Arambula, for health and aging, the bold vision. What's your take?
First and foremost, I just want to thank you for inviting me to participate in this panel today. I have found this summit to be incredibly informative and like the idea that it is a summit. And as it is a summit, we have to acknowledge that for many of our communities, we have struggled to get to this point. This vicious virus is magnifying and highlighting much of the systemic racism that has occurred through our lifetimes. As this virus is disproportionately affecting our Black and Brown and API and Native Hawaiian communities, we must ensure that we acknowledge, recognize that, and plot a path forward that is different. It is why I am so pleased that this master plan of aging is focused on equity, is focusing on us ensuring that we can increase access and care options for all members of our communities. I would like to highlight much of the work as well that's been done in terms of mental health support and dealing with the isolation during this pandemic, as well as acknowledging that we have provider shortfalls in regions of our state and need to increase the pipeline to meet the demographic changes that are coming. The challenges are great before us, but the Master Plan of Aging is an incredible document that I enjoyed reading, and as a policy wonk, I like getting back to work and figuring out what it is we can work on and collaborate with, and I'm excited to share some of those as we go forward.
Thank you so much. And Maya Altman, you have been both a thought leader for so many years and also on the front lines of this moment that Dr. Arambula spoke to so powerfully. Maya, what's your perspective on the vision forward?
Yeah, thank you, Kim. And thank you for inviting me. I have to say, I did not coordinate with JC on this, but I have some similar perspectives, but I'll try to emphasize some other things as well. First of all, I want to say that particularly the Health Reimagined section, I think it's excellent in terms of the breadth of goals and strategies that are outlined there. I mean, it touches on a lot, as you mentioned, Kim, including prevention, long-term service supports, changes that are needed in service delivery, and workforce. I mean, that is so important. And there are many other critical issues that I won't have time to get into today. I also really like the fact that there's something in there for all populations. It's not just Medi-Cal, but it's middle income people. It's people that I think for every population in California, there's something in there for them. What I'm most excited about, I think, are four things. First of all, the focus on leadership in the governor's office, which Fig mentioned at the top. I think that is critically important. Secondly, the bridging health and home. I think that's a great phrase, and it really captures the importance of integrating the health and LTSS experience for a consumer. They don't just come in with needs for long-term service supports or just needs for healthcare, but we have two different and very separate systems for dealing with that. And so I think getting at that main issue is a vision that's so critical for the future. I also, top of mind, the Medicare Innovation and Integration Office, as JC said. I think there's just tremendous potential in Medicare and for people on both Medi-Cal and Medicare, as well as the Medicare-only population. I mean, I always follow the money, and that's where there's a lot of money. And I think there's a lot of potential working closely with the federal government to make sure we have a more coordinated approach. I also want to mention the universal benefit for long-term service supports. Again, for everyone, not just on people on Medi-Cal. There's not as much progress as we'd like to see given the economy and all the crisis we're facing, but I'm really encouraged to see a commitment to pursue that. I love the roadmap for LTSS, as JC said, that there really is going to be a focus on planning to ensure that there's a robust menu of LTSS services available in every single county in California, rural county, urban county, doesn't matter, every single county. The next area I really want to touch on is nursing home innovation. I saw something in the chat about nursing homes and assisted living and what a crisis we're in. There's so much to do with nursing homes in the wake of COVID. And there's, we could spend the whole summit on that. But what I really want to bring forward is that I was really encouraged to see is that there's a stated strategy in the master plan to reimagine nursing home care for the long term. Specifically, how can we grow smaller and more home-like nursing homes? We're not going to have it overnight, but I think that is such an important goal for the long term. And then the promise to really undertake a concerted effort to figure out how to pay for quality of care, job quality, equity, and health outcomes, good health outcomes in nursing homes. How to do that much more effectively than we do today. And finally, a commitment to expansion of transparency of the information that we all see on nursing homes in California. And then the last thing I just wanted to mention was that it's not in the Health Reimagined section, but as others have pointed out, the housing and health. I mean, we can't separate those two. Health is housing, housing is health. And then there's a lot in the master plan in different sections about telehealth, which is going to be so important for transforming our healthcare system. I guess the one thing I'm most worried about is really, and this was a priority for the stakeholder advisory group, was fixing long-term care and LTSS in the broadest sense. I think there are a lot of pieces in the master plan, a lot of great pieces, but I still worry about the laser focus needed to really make progress on that. That's something that's eluded the state for years, and I think we still have to sort of recommit to providing solutions in that area.
Excellent segue to, okay, how do we get started on that in the next 2 years? As Senator Wiener said at the last panel, we are still in the pandemic. We have vaccine job one, we have mental health issues, we have eviction, lots pressing, but also, again, making the work even more urgent. JC, how do you think about tackling priorities for this 2 years, this session, so that we look back in 2 years and we have moved towards that 10-year vision?
Yeah, so I'm kind of aligned my comments with kind of the 10-year comments of what we're going to do in the next few years specifically. So the most important for us and top of mind is really working on CalAIM. That will be an upfront thing in 2021, preparing for hopefully a January 1, 2022 launch as proposed in the budget of enhanced care management and the in lieu of services. We have a lot of work to do, especially because providers are going to be stretched a little thin with their continued response to the public health emergency. We know that. So we are working on comprehensive toolkits and cheat sheets and information that can help them get there faster as much as we can. We've brought on a new team to help us with that. And so you will hear a lot of information coming out from DHCS on enhanced care management and the various in lieu of services, very critical to the work within the Master Plan on Aging to be successful. And so that will be a key focus that you'll see the department issuing guidance as soon as mid-February. Those will start flowing out in regards to those pieces. And would just note the updated CalAIM proposal is on DHCS's website. If people didn't track that through the budget release, that is out there. Still a lot of work to do. I think the next one, top of mind, next 2 years, just heard it from Maya, is telehealth. The department will be releasing our comprehensive telehealth proposal February 1st. Enjoy looking forward to those conversations around across the delivery system. That includes looking at LTSS services and how we can look at telehealth within our home and community-based services as well. So that is included. And then, of course, proposed in the budget is remote patient monitoring. Very critical for our older adults, an important benefit to allow for more flexibility for people to stay in the community, to stay home, and to have adequate access to a really important benefit. So we're excited about that. And then The last two for 2-year outlook, we, as many know, will be looking at how do we infuse quality in the way we pay for skilled nursing facilities. We started this conversation in the last budget. We look forward to continuing it again this year and next year, but really stepping back and thinking about from the Medicaid payment perspective, how do we look at quality and outcomes in the way that we paid for skilled nursing facilities and long-term care in California. And then last but not least, for the next 2 years is standing up that Office of Medicare Innovation and Integration, getting it going, and really making some good progress with the new administration coming in forward to us. So that is our kind of 2-year roadmap. There's other things, of course, on that list, including working to, the caregiver supports into our assessments. I think all of that will be built in the construct of CalAIM, but I'm excited for the next 2 years within the master plan objectives.
Thank you. How about you, Assemblymember Rambula, as you look at the session you've began Monday? What are your priorities to move forward on this agenda?
Thank you for that, and really do want to appreciate the administration for working collaboratively with us as a legislature. It's exciting times for us to be working on projects like CalAIM and all of the integration and improvements that we can make to the system. But I wanted to actually give you the specific improvements by number, if I could, based off the master plan of aging, because I'm wonky like that, but actually was really into 33, 36, 46, 54, 55, 60, and 68. I will go through them. 33 is dealing with the federal government and long-term supportive services. It's really advocating to make sure that we receive that benefit. 36 is much closer to home, but it is what JC was talking about with CalAIM and making sure that in lieu of services and the enhanced care benefit is provided will allow us, as Senator Wiener said, to allow our elders to age in place gracefully, and believe that should be our goal. And that benefit is something that I'm quite excited for us to work on. 46 has been a passion of mine for a while, which is health for all elders, and making sure that immigration status is not a prohibiting factor to caring for all Californians, and we'll be happy to continue to advocate for that. 54 and 55 have to deal with the pipeline and ways in which we can make improvements towards geriatric care, and whether or not it's in the licensing or in the training, there are multiple ways that we can improve providers to deal with the demographic changes that are coming. 60 deals with us collecting data as a system and identifying gaps that we may have, and believe it's incredibly important to see within the master plan of aging the collection of data so we can hold ourselves accountable, and really wanted to highlight that as one of the strengths of the proposal. And 68 deals with a need for us to have a COVID 2020 report on our skilled nursing facilities. I think we have to take a hard look at what we can improve upon so we can help to inform other states as well, and prepare for other epidemics that may come. Finally, just because it's a passion of mine, I do think I would like to highlight 52 and 53, which really are dealing with the mental health crises that our elders are going through right now. If we could get federal funding for the friendship line, that would be incredible, and as well as our ability to work on specific plans for suicide prevention for our older adults would be a tremendous benefit for our community, and a lot for us to work on in the next 2 years, but I'm looking forward to it.
That's terrific. Maya, what's on your 2-year list?
Well, that's a hard act to follow. I don't have the numbers handy, but as JC said, I'm coming from a Medi-Cal managed care plan. Of course, the CalAIM is going to be our #1 priority. I just want to say the in lieu of services is probably the worst jargon in the world. So I just want to put a little, it's a federally defined term, and so it's a technical term, but what that means is really giving plans and communities the tools to provide services that are not your traditional medical services, services like housing, services like paying for residential care facilities, services like paying for home modifications. It really, my one of my main goals is to not only within our plan, but working with all the plans across the state, is to provide more alternatives to nursing homes. And I think these, let's call them supplemental services, or instead of, but what that means is it really gives us the tools to make that a reality and to make a lot of progress in that area, and to invest in our communities to make sure there are LTSS services and options available. So that is top of mind. Second, I don't know if I'm going to be part of the work group, but I think of the detailed roadmap for bridging health and LTSS. I hope we can get a roadmap done by the end of this year, but if not, then by sometime in 2022. So we really know where we're going and how we're going to hit that target in 2027 to have a statewide benefit. And then finally, I want to lift out one recommendation that I don't have the number for it, but it has to do with IHSS. And it has to do with models for care coordination for those who cannot self-direct because they have cognitive issues, such as Alzheimer's or other dementia. But that's something, Kim, you said, that I see on the ground a lot with our members that are IHSS members, a huge need. And so I'm really excited about working on that particular initiative.
Well, thank you. And before I, am I still okay? Getting
Yeah.
Okay. Before I turn to the lightning round with your final thought, I want to just build on that dementia comment to say, as you see in the health, while CalAIM and DHCS's leadership is the driving piece, there are pieces throughout Health and Human Services. So we have our behavioral health task force at our agency that the Department of Aging was just added to. So we'll be joining to help lift up elder behavioral health needs. CDPH, number of dementia investments prioritized by Maria Shriver's task force and in the governor's budget for the legislature's consideration on research, on training, on public education, all with that equity lens. And our friends at OSHPD also looking at geriatric pipeline. So lots and lots of work across agency on health leadership. Okay, that gave you a moment to think about your 100-day commitment. You've heard a lot about the 2 years, which is really an extraordinary list. I just want to reflect back to all of you. But let's do a 100-day commitment round. JC.
Sure. So maybe I should add one to my list that I didn't have before, is to work with Maya to come up with a different name than in lieu of services, because we get that all the time. We haven't been able to find something that fits the magnitude and importance of it, but we'll get there. I promise we will, because in lieu of services, you're right, it's horrible. Next 100 days, I'm going to stay even a little bit shorter than that, is we are relaunching our CalAIM. So this is a plug. We will have a webinar that will be announced shortly, January 28th, to just inform people around what changed from the proposal, what was embedded around feedback from people, what are the new dates, et cetera. So just really putting that information out there. We will be focusing on a lot of the things in lieu of services as one, and others that will be rolling out so people know what to expect in the next few months from DHCS. And then another plug, very specific to this area, is we are also announcing our Managed Long-Term Services and Supports and Duals work group. That will be launching the initial work on February 4th. Registration information will be released soon so people can join us. And that's really being thoughtful and thinking through with key stakeholders and partners, our duals integration work, specifically tied also within CalAIM. So that will be my plug, I would say, for the next 100 days, even a little shorter than that. And, DHCS just really looks forward to collaborating with so many of you in the very important work within the Master Plan on Aging and all of the hard work that was put into doing it to improve, the lives of our older adults within California. So look forward to continued conversations.
Thank you. Assemblymember Rambula.
Within the next 100 days, now that we're back in session and here in Sacramento, I'll have an opportunity to bring in Sub 1 and allow us to have a conversation on many of the proposal the administration is putting forward. I have truly grown to love the public process and to enjoy the participation from those who are on the front lines so that we can make government work more efficiently and effectively with the programs that we design. And so I'm looking forward to the opportunity to provide some insights and to hear from the public what they think about the programs that we're developing and working on as well. Now, I would also like to just add, I think we need to push our federal administration during this time to make sure we can partner as much as we can in providing flexibilities, both to regulations, whether or not it's via waivers, to improve the delivery of services. This is a key opportunity that we have not had over the last administration, and look forward to these next 100 days.
Thank you. And I just want to, if I may take a moment to say how much we've appreciated your skillfulness at managing public hearings in this time, and the accommodations and inclusiveness of the virtual hearings have actually in some ways been even more inclusive of older adults and people with disabilities. So thank you for your investment in inclusion and hearing from the public and stakeholders. It's much appreciated by our community. Maya, looks like you get the last word.
Okay. Yeah, I think the idea of connecting with our federal partners in the first 100 days is incredibly important. Very good point, especially since our president-elect did make certain commitments about during the campaign about caregiving for older adults and children. So we want to make sure that we hold the federal government accountable to that. But I think for the first 100 days, I have to go back to what Senator Weiner said. We need to vaccinate our members. And we have about 40, we think about 40% of our membership falls in the high risk category of age or underlying. So that is our #1 priority for the next 100 days. But after that, I think besides what JC said, I think it's really important to amplify the message around the master plan and create even more support. And so the Stakeholder Advisory Committee is continuing to meet on its own. Every week we have calls and thinking about how we can connect with the legislature and with the administration, and with other stakeholders and organizations to keep pushing these priorities. And so I think that'll be really important in the next 100 days as well.
All right. Well, no shortage of action on health in the short, medium, and long term. And again, it can't come soon enough given what the terrible experience we're coming out of, but we are in great hands with the leadership that we heard from today. So thank you all for your time and attention on a busy day. And we will transition to our next panel. Equity and inclusion, not isolation. This is a very central part of our work plan, of our master plan. We will have lifelong opportunities for work, volunteering, engagement, and leadership, and will be protected from isolation, discrimination, abuse, neglect, and exploitation. And the target here is to keep increasing life satisfaction as we age. Many people on this call may already know that overall life satisfaction does increase with age. And our goal is to keep that vision being a reality in California, again, emerging from this very, very tough time. This panel is going to be a little bit different, in part because I am the state person who will be presenting on behalf of Department of Aging, and I'm thrilled to be doing so, and in part because Senator Melissa Hurtado had an emergency come up and is not able to join us. So we will get to hear more from Edie Yao, which I'm just delighted if we can have the switch from Maya to Edie. Edie is the Director of Diversity and Inclusion at the Alzheimer's Association and was a founding member of our equity work group that was formed a few months into the master plan for aging process when it became clear there is no master plan on aging without equity baked in. So Edie has been a very important part also of our coronavirus pandemic response, helping lead calls for caregivers, supporting friends and family caregiving. So with that, hopefully we can see Edie very shortly. Wonderful. Welcome, Edie.
Hi, Kim. Great to join you, and thank you for all your work on this. This is fantastic.
Well, we're going to have a little bit more of a dialogue, but we're going to stick with the same format of that 10-year vision, the 2-year accomplishments, and our 100-day resolutions. So I'll start doing the state voice, and then we'll. I want to hear, as I mentioned, from you. So the inclusion and equity, not isolation, has a range of partners for the Department of Aging and for the aging community writ large. But I really want to focus on just one for the kind of 10-year vision, which I think is so fundamental and foundational, which is the equity baked in piece. And I think we learned from our work with the equity work group and the leadership of Rigo Saborio from St. Barnabas and so many others, that there's a number of ways we mean equity, that clearly ageism is rampant in our culture. We know about it in Hollywood, but it's also been such a challenge in the COVID response and so many of the aging policy issues. And we were grateful to have a town hall summit on ageism with Shireen McSpadden, one of our civil rights leaders in the nation, who's San Francisco County Aging Director, as well as the Meta Fund and others, about the San Francisco anti-ageism work. But we also really looked at the intersectionality with aging and race in particular. And we really need to continue to lean into that work because of both what we already knew about health inequities and the experiences of racism in this country leading to different aging experiences, as well as all the cultural resources and richness around aging traditions. But you cannot speak to the moment and the white supremacy that is on our television and in our news moment by moment, and know that we are entering a critical moment to really lean in and dig into our anti-racism work, and that includes the aging community. So I think really holding ourselves accountable on our training, on our hiring, on our recruitment for advisory committees, on our peer-to-peer training of our providers, and of course our service delivery to people most in need in culturally competent ways, and results. Are we changing people's lives? So that is the one that I think is really underlying the 10-year vision, and of course, not just in this goal, but the whole plan. And when we get to the 2-year question, I'll speak more to some of the initiatives and try to do the numbers like Assemblymember Rambula did. But just really want to focus on equity as the 10-year core from where we start. How about you, Edie?
Yeah, well, I was going to say, I mean, my reaction from reading this and just seeing it was, it's visionary. I mean, you've sat in on these equity work group meetings, and I'm so proud to have been a part of it. And we had really in-depth conversations about this, how it, as you said, it really needs to be so well integrated from the design to the planning to the implementation. And you see that in the plan, and it's across pillars, which is what's really exciting, or goals, right? So it's not isolated. Oftentimes you see it isolated only in one section or an afterthought, and this is not that case. And I think the governor's office has taken this very seriously, and certainly I hope that our equity work group and all of the people from the public who've contributed to the conversation feel that in this plan. So the challenge is then, how do we execute this with that equity lens? And I would highlight that I love that there is that data dashboard, right? Because we've talked so much about the need to keep us accountable and to measure our progress. And I've played around with it. I love how interactive it can be. So people can, in fact, look at it from their local counties and see, where do we stand now? Where do we stand later in that 10-year plan? We can then look at progress, look at where are the opportunities and where are the gaps. So that's a really great piece. And I think you're right. I mean, I think about, I'm also really excited, being from the Alzheimer's Association. I would be remiss to not say I'm thrilled that Alzheimer's is also well integrated in this plan, because we know 2.3 million Californians are impacted by Alzheimer's, whether they have it themselves or are a caregiver. And so that's such an important piece. And working with underserved communities, I think what we're seeing also is that Alzheimer's, or any condition, it's not an isolated disease. You do have to look at who they are and where they came from. And so any of those historical injustices do come to life. And that's why it also brings equity to such the forefront of where we are now. When you look at, police brutality, and you think about someone who's caring for their loved one, African American, wandering on the street, what are the risks for them? May be different from our white constituent, right, who's wandering with dementia. So these all have a real interplay.
Well, that's a great and profound lead into the 2-year initiatives that are top of mind for me. And I was trying to keep up with Assemblymember Arembula and do the numbers, so I'll try my best. But one of them is the Elder Justice Council, number 93, I believe, which is we really do believe it's time to convene state departments as well as our community partners and making sure that we have a coordinated Elder Justice Council, but deeply informed by racial justice and what we know about different experiences with different systems. And again, I often make connections to the child welfare world, which there is a state child coordinating council, which has done work to make sure that their work is anti-racist and is culturally informed. And I think we can learn from that and from other emerging work all around us. So Elder Justice Council is on my 2-year list. And then a number of the leadership items. Department of Aging is both tasked by Older Americans Act and by the governor's executive order to really help grow the leaders in aging. And there's so many opportunities in here. 98, which is to create that one door in the community for anyone who has a question about aging or disability, to get more than a info and referral, but really some assessment, some assistance with enrollment, perhaps some care coordination. But we really need to get our support local networks all across the state. We have many seated and growing now, but have that be seamless statewide. One website, one phone number, one portal, so that it is much easier to navigate this world. And then referring back to the work we just heard about, there's services on the other side, whether it's from CalAIM or from Medicare or from the social side, the community side, that it's easy to find and then they're there when you need them. So 98 will be a top priority in the governor's budget. Our ADRC committee meets Friday to really dig in on what a statewide expansion would be. And then a couple others that are unique for California. I think to your point about data, the University Research Partnership, we're so lucky in California. I saw JC's, I think it was USC banner earlier. We had members from USC, of course, Laura Carstensen from Stanford, David Linderman from UC Berkeley, who want to partner with the state. And the state has lots of data that appropriately hubbed and scrubbed can be enormously useful to our research partners at universities to be really a global leader on aging trends. And again, with that equity lens. So we're very excited to dig into how do we form that world-leading aging research and data partnership. And then the other one I wanted to look up, of course, is 101, which is actually looking at ourselves. Looking at CDA and our area agencies on aging structure, which was established in 1980, the state local partnership, 33 local areas, agencies on aging. And really, as we're looking to 2030, take a fresh look at our 1980 structure and see where it works, where we can strengthen it, and where we might need to do some tuning up. And so I think those are some of the leadership items that we'll be really looking to move forward the next 2 years. How about you? What's on your 2-year?
Yeah, I think that's great. I think a lot of organizations are taking a hard look at themselves, aren't they? And to see it as an opportunity, right? The way we've done things in the past does not have to mean that we continue to do that in the future. There's opportunity to grow and evolve. So I think that it's commendable. So certainly around equity and Alzheimer's, and I don't know where this sits. It might be in the health. So I'm hopping different goals, but I think that equity piece, again, when we think about Alzheimer's, I'm really excited about the component for looking at Alzheimer's research focused on women and people of color who are disproportionately impacted by the disease. We know that African Americans and Latinos in particular are more impacted by Alzheimer's. So we need to understand that more from a research point of view. Why is that? And what are some things that we can do to look at social determinants of health and also look at how this evolves into the health disparities? You mentioned in the previous segment about the education piece, and I think that's really important too, around that brain health campaign, understanding how that is so important and looking at that. Hopefully we can look at the lifestyle factors or understand that piece so that we see a way to reduce the number of people with dementia or Alzheimer's, or get them to the doctor sooner if they see the symptoms. So all that education, whether it's a public campaign or to healthcare providers, is really critical. The leadership piece was also, I think, a real highlight, to have someone really focus on this, because, if you don't have someone focused on it, and it's everyone's job, it tends to get diluted. And so the idea of, having a committed leader to look at aging and Alzheimer's, that kind of a position, a senior advisor position on this, is really critical. And for me, I think really it's around the one I really gravitated towards, in inclusion and equity goal, was really the first one, which is around the culturally and linguistically competent communication to older adults and people with disabilities and their families. When we did that caregiver series together with CDA, we offered it in English, and then we did offer it in Spanish and Chinese as well. And I think often when we're thinking about communication, you think about, it's not just the translation, it's the transformation and making sure that it's culturally relevant. And likewise, even in English, thinking about health literacy, so it's making sure that people understand in lay terms. So that's a really important one for the next 2 years for me. And I would point out that the other piece that's really critical here in this goal is, in goal 3, is that digital divide, because that's the one that we've certainly seen through COVID. Everything is digital these days, and I was shocked to see, what percentage, it was something like 34%, right, of Californians over the age of 60 or 65 are not connected to the internet. And so I think that's a really important piece to focus on in the next 2 years as well.
Excellent. I was just, as part of our Living to Our Leadership, trying to take a moment to take questions. We've had about dozens of questions come in, and I'm trying to see a couple. One, I want to just hear from the community asking, where's IHSS in the plan? And there's a couple places where, of course, IHSS is one of California's shining stars of health and home bridging, and that health and social model. But 2 items specifically about IHSS, one that Maya mentioned earlier, number 65, about seeking feedback on models of care coordination for IHSS participants with dementia or cognitive impairment. Is there a way to do that that still brings forward the best of the IHSS model of client determination, and also recognizing cognitive impairment and dementia whole person needs? And then another item on IHSS 39, explore the opportunities to increase stability for IHSS beneficiaries through backup provider system, which again is in the governor's budget release last Friday, recognizing wildfire and pandemic and other strains that have made a backup registry system, backup provider system, even more important. So at least I wanted to speak to that. Some other questions that have come up around data and asking, are we going to collect data around different indicators, including different types of disability? And I would say yes, and it's an ongoing project. The folks who've worked for a long time on SOGI requirements, sexual orientation, gender identity, know that there's been progress, and so much more is needed. And I think the same is true for many of our indicators as we pull apart race and ethnicity, and even an age. Over 60 or over 65 isn't always that useful given the diversity in age. So I think there's, as I mentioned, the data dashboard is 1.0, and you will see continuous updates as more data sources are available. One that we're particularly looking forward to adding in is the new state data on homelessness coming this spring, so that we can have, right now you'll see kind of those point in time counts from various communities, but really looking forward to spotlighting the work of leaders in that area. So lots on that front. Okay, Edie, now it's time for our, what are we going to do in 100 days commitment? And I think I probably, I have a little bit of the easiest one, in that we commit to number 104, which is the master plan for aging, the new board, if you will, the impact committee, implementing the master plan for aging in California together. We do want that. I heard Senator Wiener say that was about mid-April. So by then we will have named and formed this impact committee. But I also want to lift up for folks that we expect that really to be about holding the master plan accountable, that a lot of the work is happening at the CalAIM work groups, and at the new Elder Justice Council, and at the Strategic Growth Council, and the Alzheimer's Advisory Committee, and Olmsted. There are so many tables to plug in and dig in. I loved some member Randall's a tribute to wonks. We need all advocates and wonks of any stripe to come to all those tables. And so I hope people that will have a great and diverse group of folks to serve on impact, but also there are so many ways to serve. So stay tuned for more on that, but that's 100 days that we will make sure happens. How about you, Edie?
Yeah, well, I will have to say that given COVID, ending social isolation and reuniting families is front and center for us. Absolutely. So, I mean, that's really when you talk about no matter who, equity, inclusion, I mean, all families are really suffering from social isolation. And so as this vaccine rollout happens, and we know that long-term care residents and staff are a priority, but also thinking about so many of the families are at home. People with Alzheimer's and their caregivers are at home. And so making sure that that communication goes out to them and that they're part of this process of successfully getting access to the vaccine. That's a pretty important piece. And I think we have to continue to explore ways of communicating effectively with our constituents. Again, that culturally and linguistically competent communication is really important. And so that's something that we're always looking at, but that would certainly be a forefront around this and other things that come out related to the vaccine and COVID and whatnot. Other than that, I mean, I think that the whole master plan, given so much of it is connected to the work that we do at the Alzheimer's Association, we want to continue to be a partner with the state and with other agencies and entities to really see this through. And so I guess I would ask you as well, you know, if you have any particular suggestions for how we get this out. This summit is great, but, you know, are there other ways that we should be working more strategically with local partners and entities to get this message out about the MPA?
You know, it's a great setup to something, both of your comments make me want to say this, which is, yes, we very much want the local playbook to be a way that we can engage with the many communities who have already joined AARP, the several who have their own master plans for aging, either on the whole population like San Diego and Los Angeles, or LGBT aging in San Francisco. We want to do that. We're thinking about the right time and place to do that. But to your point, it's not a normal year. It's not a normal first 100 days. And we really want to make sure that while we are not losing momentum, we are moving full steam ahead, but that we are also acknowledging the very real work ahead to get the vaccines out and also to reunite, I think was the word you used. And there will be logistical work and there will be emotional work on that. And so I think that's been one of the challenges of the master plan, is how we both keep going full steam ahead. The work is more urgent than ever, but also acknowledge that there is other really important work in our professional and personal lives going on, and we need to honor and respect that and support each other in that. So that's a long way of saying, I don't know when the time is right for our local leaders. I think, as we all said, it's vaccines. And then there's going to be this coming out of the COVID as we rebuild and hopefully build back better. And so we want to be there for people at the right time in the right place, with the playbook, with the dashboard, with new partnerships. But I think it's still too soon to tell what exactly that looks like, when that looks like, and we'll be looking to hear from all of you about when the right time and place is.
Fair enough. Absolutely. Yeah. I just lost my thought, but I appreciate that. And I think that actually the local playbook is great. And so we should encourage people to use that. Absolutely.
Yes,
Thank you. Yeah.
We'll be speaking to County Welfare Directors Association tomorrow. We have an invitation from some of the long-term services supports collaboratives. So we welcome those invitations, but we also know that there's multiple priorities at this moment. So, and support people working on all fronts. So, and resting as well. So in that spirit, we are actually running a little bit ahead of time, and we actually did want to give everybody a 5-minute break. Take a deep breath, check your email, go drink of water, check the news. There's been some news since we started, and we will return at 2:45 promptly for an all-star lineup. Secretary Sue will be joining us, as well as Assemblymember Adrien Nazarian's Chief Consultant, Liz Fuller, and Dr. Donna Benton, and of course, Kim Johnson, Director Kim Johnson, and Kevin Prindeville after that. So more to come. Enjoy your break, and we will see you in 5 minutes. Thank you.